And welcome everyone. My name is Lindsay. I'm the health coach here at Alive and Well, and we're joined with Elise, our new family nurse practitioner. And we are going to
Hi.
talk about our weight loss medications. So the myth, weight loss medications are cheating. So these are a few of the things we're going to go over. You're going to meet us and we're going to go through the functional approach to weight loss. We're going to talk about the peptides, and then we're going to go over all of the frequently asked questions. I apologize ahead of time. I'm a little under the weather, so I have a bit of a cough. So this is Elise Clark. She's our family nurse practitioner. Thank you so much for joining us today, Elise.
Yeah, excited to be here.
And my name is Lindsay. I'm a functional nutritionist, a health coach, and a personal trainer. So this is your team for the weight loss program. And this is our functional approach to weight loss. Here at Alive and Well, we are excited to bring you a fully virtual, medically supervised weight loss program. We leverage in-depth testing, health coaching, education modules, and provider prescribed weight loss medication to support healthy, sustainable weight loss. This is a quick testimonial of a couple of my patients. This is two different ones. A couple of testimonials from patients that I've worked with. I'll let you read over that really quick, and then I'll move on to the next slide. And so Elise is going to take over right here and talk to you about the medications.
Yeah, so I know semaglutide is a little bit of a buzzword right now. There are some branded options out there that have commercials everywhere too. So I'm sure you've heard of some of these medications. But the one that we use is compounded. So it's just that generic term semaglutide. And there's actually another one called tirzepatide that we'll look at in a second. But semaglutide, the technical term is a glucagon-like peptide. So it targets areas of the brain that help you feel fuller. So you kind of get a quieting of that food noise. It's a big thing we hear from patients. So you're not as hungry, you feel satisfied faster, and then that decreases your food intake. But it also acts directly in the gut too. So it increases insulin secretion from your pancreas. And that's a big issue with resistant weight loss is insulin problems. So this can help solve that term insulin resistance if you've ever heard of that or been diagnosed with that. So it helps with insulin regulation in the body, and it slows down how fast your gut empties. And that's important because it decreases the amount of sugar that you absorb from that food. And that's a big reason why these medications were initially made for diabetics. So it really helps with that blood sugar control. And then a wonderful byproduct is that appetite control as well. But what we find is that a lot of people who need to lose weight end up having sugar insulin problems they didn't know about. So the medication is really beneficial in multiple ways. So you feel full longer, you eat less, and it helps improve insulin resistance. And that is part of metabolic syndrome, which can happen over time, largely due to lifestyle choices, toxic exposure, genetics, hormone dysregulation. So that's why I do really like these medications, because that often underlying issue with insulin resistance can be corrected, and then you don't struggle as much going forward. And then the next one, tirzepatide. This one also has a branded product out there that you've seen commercials for, but again, we compound it, so it'll just be called that generic tirzepatide. So it's similar to semaglutide, but it has some additional actions. So it's called a glucagon-like peptide 1 receptor agonist. Not that y'all care as much about the technical terms, but I think it's important to know. And then a glucose-dependent insulinotropic polypeptide receptor agonist. So those are giant mouthfuls. Just remember, it works in two ways, whereas the semaglutide really works more in one way. Both are really effective, though. Tirzepatide, it's designed to mimic the actions of GLP-1 and something called GIP hormone in the body. So that helps really regulate blood sugar levels. A common way that I hear this described when people talk about the benefits or differences from one to the other with semaglutide or tirzepatide, tirzepatide is a little bit newer, and it binds to receptors a little bit better, like a little bit more fully is how I've heard it described, which makes the most sense when we're talking more in lay terms. So the unique aspect of that is that it combines the actions of two different hormones, and that leads to more effective blood sugar control, and it does have a little bit more weight loss benefit as well. So same mechanism of action as the semaglutide. It helps with insulin secretion. It suppresses glucagon, which is a hormone that raises your blood sugar. It really causes your liver to release extra stores of sugar. And we don't always want that when we're trying to lose weight or regulate sugar. Slows down how fast your gut empties, and it promotes that feeling of fullness or satiety. So studies have shown that this dual action peptide, the tirzepatide, it's a little bit better at lowering BMI and lowering blood sugar. Now, a question I would have is, well, why don't we use this one in everyone? Because semaglutide is usually a little bit more accessible and it works really well. So we typically have a recommendation of one versus the other depending on the patient. Tirzepatide is kind of like that next level if you need it. And so where are we getting these? I get asked a lot, is it compounding different than the traditional medicines? How do I know if it's working or not? Is it better or worse than the branded products? And it's all about where you get it and then where those pharmacies are sourcing their product. So compounding pharmacies custom make medications for you, where your traditional big box pharmacies, they'll have medications on the shelf in all these different doses. So whenever a prescription gets called in, you just go pick it up. It's already been made. Compounding pharmacies are different. They get a prescription for these medications or progesterone or whatever it is we're sending in, and they make it specifically for you. That's why compounding is a little bit different and sometimes better. In Alive and Well, we source the weight loss medication from Grand Avenue Pharmacy. So it's one of the largest compounding facilities in the country. They have a lot of certifications for safety and cleanliness and meeting FDA standards. So long history manufacturing peptides. And that we've worked with several other pharmacies, and this one has been really top tier in terms of quality and customer service and timeliness and all of that. So effectiveness, we've had several hundred patients come through and the results are overwhelmingly positive. And Lindsay and I were just talking about this before we hopped on. I came from another functional medicine clinic where I've been doing this for several years. And prior to that, I worked in the endocrinology setting and I was actually using it for blood sugar control. And so I have probably 8 years of using this medication under my belt in one form or another, and it works really well. And as long as you have the lifestyle changes behind it, you get these health coaching visits with Lindsay to keep you accountable, get some nutrition advice, exercise advice. As long as you're sticking with that, making those lifestyle changes, it's really effective. You get that foundation to create long-term sustainable results. And it's really just those people who use it as a quick fix who you hear those bad stories about where they rebound. So if you're really committing to a healthy lifestyle, we don't see a lot of rebound weight gain. So in that sense, it's incredibly effective.
Great. Thanks, Elise.
Yeah.
So we're going to talk a second about potential side effects. So as with most medications, side effects come along with it. The most common side effects for these weight loss medications may include nausea, diarrhea, vomiting, constipation, stomach pain, bloating, headache, fatigue, dizziness, gas, and heartburn. I have been the health coach for the program for a little over a year now, and the most common side effects that I see are nausea, fatigue, and constipation. Some patients have zero side effects and they feel great, and I have had a handful of patients where the side effects are intolerable and they can't continue the medication. We can't tell how someone is going to respond. It's very individualized. Elise, did you have anything you wanted to add to that?
No, I agree. I think the most common things would be the nausea and fatigue, and a lot of that is dose dependent. So if you're getting results on a lower dose and you feel good, we don't push things up too much. When you start to get to those higher doses is when I see more of that fatigue. Now, the good thing about the nausea is it's usually knocked out with some lifestyle choices or changes or using the medication Zofran. It's really effective for the anti-nausea. So
Great, thank you. Yeah, and so that's something that we do here is we help walk you through and help you mitigate any kind of side effects that you're experiencing. And so we're going to jump into the frequently asked questions. If you find that you have any questions, you can pop them in the chat. So the most popular question is, how much weight will I lose? So weight loss success varies greatly from patient to patient as there are many factors involved. We're seeing an approximate 5 to 10% weight loss in most patients. So again, just sort of like with the side effects, it's really hard to tell how someone's going to respond to the medication. Do I need to follow a strict diet? You do not have to follow a strict diet plan in this program. However, eating a healthy diet is strongly encouraged to help with weight loss and keep it off once your program has completed. We recommend increasing your protein intake to help negate any possible decrease in muscle mass. And this is something that you and I will talk about in our first health coaching visit. Our subsequent visits are about 20 to 30 minutes, but our first visit is a little bit longer and it's very foundational. And we talk about muscle mass preservation. That is something that happens a lot with these medications when people don't get the proper education about how to maintain their muscle mass. And we don't do any kind of calorie counting. We focus on nutrition and we focus on protein and fiber, and everything else tends to fall in place. Will I feel an energy deficit? Patients do experience varying degrees of fatigue while on these weight loss medications. Again, some patients experience fatigue where they have to take a nap. I have other patients who feel great on the medication and don't experience any fatigue. Can I exercise while on these medications? We highly recommend adding strength training to your lifestyle as it helps prevent muscle mass loss, as encouraging weight loss during and for maintenance after the program is over. So it's important to note that you're in a weight loss program, not a fat loss program. And the way the medication works is it's suppressing your appetite. And as Elise mentioned, it's quieting the food noise. Sometimes I think people think the more medication they take, the more weight they're going to lose. But what ends up happening is your appetite just gets more suppressed and you'll end up losing weight basically through starvation because you can't eat. And what'll happen is your body will digest not just your fat, but your muscle tissue as well. And that's something that we don't want. So strength training is going to be a great way to help preserve that muscle mass. And I do walk patients through. If you don't have any exercise in life right now, that is okay. I will walk you through slow, small, sustainable changes to help slowly integrate that so it works with your lifestyle. Will it alter my metabolism? These weight loss medications have not been proven to change resting metabolic rate. What is self-injection? Self-injection means you'll give yourself the injection and you will be provided a detailed tutorial once you begin the program. Is it safe for everyone? These weight loss medications are not for everyone. Patients who are pregnant, experiencing pancreatitis, have active gallstones, or have a personal or family history of thyroid tumors or medullary thyroid carcinoma are not eligible for this program. For individuals of reproductive potential, avoid pregnancy during weight loss medication use by using effective contraception during treatment and for at least 2 months after discontinuing injections in female patients. Elise, did you have anything you wanted to add to the is it safe for everyone?
No, that really covers all the big contraindications. And, it's not like taking the medication are going to cause any of these things like pancreatitis or gallstones. It's just if you have that existing condition, slowing down your gut motility is not a good idea. And then pregnancy, of course, we don't want anyone to be trying to actively lose weight while they're pregnant.
Great, thank you. How soon can I expect to see results? Results will vary by patient. You may begin to experience some effects early on, such as a smaller appetite. Full effects can take up to 8 weeks and potentially longer. Dietary and lifestyle changes also create a greater impact on your results. So again, I have some patients who will start losing a couple pounds like within the first 3 or 4 weeks. And we have some other patients that, their body is in a little bit more resistance for whatever reason, and it takes a little bit longer. But patience is definitely a variable that needs to be added in here as we're introducing a pretty strong medication into your body and you need to give the body a chance to adjust. What if I don't lose any weight? If you're not seeing results while taking the weight loss medication, there may be other underlying causes preventing your weight loss. So your medical provider may refer you to the functional medicine clinic for more testing and evaluation. And that's the one thing I really love about this program is the weight loss program covers like all the foundational basics, nutritional basics. We get into exercise, we're doing the medication, we're doing all the things. And so that your body should respond to. So if it doesn't, weight loss patients are set up to go into the functional medicine clinic to dig a little bit deeper to see why your body may not be responding. Can I stop the program halfway through? If you are not experiencing adverse effects, we do not recommend stopping the program halfway through, as you may not experience the desired results. The protocol prescribed by your provider builds gradually over time, with full effects achieved later in the program. How long can I stay on the weight loss medication? Your medical provider will work with you to manage your weight loss and how long to keep continuing the medication. And as Elise stated earlier, is, as you titrate up in medication, if you reach a certain level where you feel good and you're still able to eat and you're not experiencing a ton of results, you may stay at a lower dose longer, just depending on where you're at and how your body is responding. Will I gain the weight back? All patients experience a slight degree of rebound weight gain, which is to be expected since you're no longer taking the medication. Altering lifestyle and eating habits throughout the program with the support and guidance from your health coach is imperative to your program success. Patients who utilize all the tools offered in the program have a higher success rate of maintaining their weight loss program. I've seen hundreds of patients in this last year, and I've only had a handful of patients come back for excessive rebound weight gain, and all of them were due to self-admitted non-compliance. They went back to eating their old diet, they stopped exercising, and you just kind of go back to where you started. Patients who stay with the suggestions, who continue the diet and exercise, and who continue the accountability calls with me after the program's over, are proving to be extremely successful in keeping the weight off. Can I enroll in the program more than once? We recommend working with your medical provider to discuss options beyond the duration program. It is possible to enroll in the extension programs if you qualify. So that's something that's always an option, is doing an extension provided you still qualify. It's important to note that there's a no refund policy. So the weight loss programs we offer are 100% non-refundable. The medication, as Elise mentioned earlier, it's specifically compounded for you. And so we don't ever see or touch the medication. It goes straight from the pharmacy to your home. And so if for whatever reason you can't continue the medication, you can't send it back. There's nothing we can do with it. The side effects vary greatly from patient to patient, and some patients do experience intolerable side effects, as we discussed earlier, and cannot continue the medication. And unfortunately, due to the cost of the medication, this is a risk assumed as due by the patient, and no refunds will be given. Once the vial is started, you can use it until the expiration date specified. And the coaching calls are built into the cost of the program. And so everything is non-refundable should you choose to stop. You can pay in full, but you can also take advantage of our monthly payment options, but you are responsible for the entire payment of your program, whether you continue or not. So just a little note I wanted to add in there.